Hello students, you are welcome to SS207 class again. This is story section 13 of that course, and here shall be discussing on infection control. Infection control. This is how do you control infection in a various setting. Like you know that healthcare facilities continue to face challenges of providing care for patients who are infected. To minimize transmission during their hospitalization or healthcare provision, it is crucial that healthcare workers and other caregivers, including attendants, patients, and visitors, follow appropriate infection control prevention and control precaution. And when you have studied this session, you should be able to explain that what nosocomial infection is, how they can be contacted, to describe what they call case definition, to discuss infection control program in the hospital, and to highlight the responsibility of infection control team like you have in your various hospitals. Nosocomial infection is an infection occurring in a patient in an hospital or other healthcare facility system in whom that infection was not present or incubating at the time of admission. That is what makes that infection nosocomial. We do call it hospital-acquired infection. It means that the person did not come in with that infection on admission. Neither was he incubating that infection while admitted, but he acquired the infection while on admission in the hospital. This includes infection acquired in the hospital but appearing after discharge, and also occasional infection among staff of the facility. Which means even if he has gone home on discharge and now have that infection, which shows that he's incubating by the time the man leaves the hospital, it is still nosocomial infection. Patient care is provided in facilities which range from highly equipped clinics to frontline units with only basic facility. Despite progress in public health and hospital care, infection continues to develop in hospitalized patients and also may affect hospital staff. Many factors promote infection among these patients, the hospitalized patients. These include decreased immunity among patients, the increasing variety of medical procedures and invasive techniques which creating potential routes of infection, and also transmission of drug-resistant bacteria among crowded hospital population, where poor infection control practices may facilitate transmission. Nosocomial infection occur worldwide and affect both developed and resource-poor countries. Infection acquired in healthcare settings are among the major causes of death and increased morbidity among hospitalized patients. They are significant burden both for the patient and for public health in general. The most frequent ones are surgical wounds infection, urinary tract infection, and lower respiratory tract infection. WHO studies have also shown that the prevalence of nosocomial infection occur in intensive care units and the acute surgical and orthopedic ward. Infection rates are higher among patients with increased susceptibility to infection because of old age, underlying diseases, or on long use of chemotherapy. What are the impacts of nosocomial infection? The impacts are numerous, but let me mention some of them for your basic understanding. The first one is that it adds to functional disability and emotional stress of the patient. Somebody who is being treated for a particular disease condition now having to combat with infection acquired in the hospital setting, it will increase his functional disability because that infection will lead to loss of energy that will not allow him or her to be mobile, and also he will have emotional stress on that patient. Then it will increase length of stay in the hospital. If hypertension, the inmate he has brought in has been cured, but he has not been afflicted with nosocomial infection, he has to wait in the hospital again until that infection subsides, and that will increase the length of stay in the hospital, and the cost is also one of the basic effects, because the cost of antibiotics, cost of running antibiotic investigation, they are also part of the hazard or impact of nosocomial infection on our patient. It adds to the imbalance between resource allocation for primary and secondary health care, because economic cost in this case is considerable. People, the government or policy makers are not actually funding this kind of system of hospital acquired infection, because the money will be diverted to management of potentially preventable conditions rather than spending money on nosocomial infection. So because the funds is very scarce, so it's being used for something else. That is why people that have contracted nosocomial infection are not given any form of assistance by the government. And let me say that this infection may cause significant disease in the community. When the patient now go back to the community with this infection, the community can as well contact it from that individual and may become community endemic infection. We want to look at the factors that may influence development of nosocomial infection. Like you have seen on the screen, there must be microbial agents, and we have discussed much on that. You know what microbial agents are, and know their classes. We have done that for about 5-6 sessions ago. You talk of patient susceptibility. We have discussed also what can make patients to be susceptible to infection, which include the age, immune status, underlying disease, and diagnostic and therapeutic treatment that you are giving to the patient in the hospital. You also talk of environmental factor as a factor. It's a factor because healthcare setting have environment where both infected persons and persons at risk are congregating. So patients with infection or carriers of the organism will definitely infect those at risk, even if they are not infected initially. And also, resistance to infection is also a factor. Resistance is talking about whether the patient have some resistance in the body that will not allow him to catch the infection. So if there is some resistance, it means he is not susceptible to nosocomial infection. So these are what they call factors influencing development of nosocomial infection. I talk of case definition. This must be developed, which may include units of time and place, specific biological and clinical criteria. The inclusion and exclusion criteria for cases are precisely identified. And what are components of this case definition? It means you want to report on an outbreak. What you do is that the first thing, identify an outbreak, investigate that outbreak, and then describe the outbreak. That will give you a clue to forming your case definition. Now talk of infection control programs. These programs are what the hospital put in place to ensure that incidence of nosocomial infection is brought under control, is minimized. The first thing we talk of is hospital programs. And the hospital programs are the major preventive effort in their facility. They have risk prevention, and as well they have concern for everybody in that facility. The risk prevention is that if anybody another prick him or herself, they should have a place where he should report that prick. They put him under surveillance and they give some prophylactic treatment so that he will not be infected eventually with that infection. Then second thing is that hospitals do have what we call infection control committee. This committee provides a forum for multidisciplinary input and cooperation, and they share information. This includes a physician, which will be clinical microbiologist. Pharmacists are there, people from maintenance are there, people that are even doing the house cleaning or housekeeping, they are there, and there are people that are working in training services alongside all other clinical people. They are there to rub minds and find means of identifying outbreak of any infection and finding ways of curtailing this before it becomes endemic in that area. You talk of infection control professionals. These are people that are trained in this area of infection control. They could be nurses, they could be doctors, they could be pharmacists or any other person working in the hospital. They be treated and they be sent for training on infection control, and they will serve as trainers for other people working in the hospital. Then we should have what they call infection control manual. This manual will be given to every staff to read. It should be developed and updated by infection control team with review and approval by the committee, which will be made available for patient care staff and updated in a timely fashion so that you will bring in new things every time you are updating that manual. Everybody will not be aware of what could cause infection and how they can be working against preventing catching any of these infections. Now, like I've said before, we have discussed the role of those control team members. Hospital management, I have told you what they do. They put up a program, they put up facilities, set up the committee that will work on infection control, put a program that will give immediate respect for anybody who has reported accidental pricking while carrying out his day-to-day activities. Physicians are there, microbiologists are there too, and what they do is to take the sample of that individual to see that either he has been infected or not, and they keep on doing this serially until they are sure that this infection has not entered that individual. Then you talk of the hospital pharmacists too. They are the one in charge of drugs, and they provide drugs for people that have this nosocomial infection. And then we talk of nursing staff, and their role is to ensure that the environment is clean, and then they also train people on area of infection control. Ladies and gentlemen, I think we have dealt with this infection control to your understanding. And when next we meet, we are discussing more interesting topic on this darling course, Energy 207. Until then, thank you for listening. As I say, God bless you all.